As the number of coronavirus cases declines in China, infections are on the rise in dozens of other countries. Why health officials are warning everyone needs to be prepared. Hello, I'm Anand Naidu, and this is The Heat. The coronavirus, also known as COVID-19, is showing no signs of letting up. There are now more new cases outside the Chinese mainland than inside the country. Brazil announced its first case on Wednesday, making it the first case in South America. President Xi Jinping said China is making progress, but said the situation is still complex in Hubei province and its capital, Wuhan. U.S. President Donald Trump is expected to address the situation from the White House within the hour. We'll bring you the news conference live when it begins. But let's bring in our panel right now. Joining us from Beijing is Anna Tangen. He's a political and economic affairs commentator. From Hong Kong, James Chow is a World Health Organization Goodwill Ambassador and host of the China Current. Here in our Washington, D.C. studio is Catherine Jacobson. She's a professor of epidemiology and global health at George Mason University. And from the United Kingdom, Chris Smith is a clinical lecturer in virology at Cambridge University. Thanks to all of you for being with us. Anna Tangen, the Chinese President Xi Jinping has been talking about the outbreak. He's been talking about preventing and controlling the virus outbreak. At the same time, he says the situation in Hubei province and in the capital, Wuhan, is complex and grim. The figures we have right now, 81,000 infections, 2,800 people have died from the virus in China. What is the situation there? What can you tell us?
Well, it depends on where you are. Obviously in Wuhan, the epicenter of the epidemic, it's been very grim. I mean, people are still on lockdown, precautions are everywhere. But the good news is that the number of deaths and also new cases are falling. If you start looking around China, 13 different provinces have dropped their threat level by one level, especially in the West. It's gone from not level 2 to level 3. And in many areas in Guangdong and things like that, they have gone from level 1 to level 2. So here in Beijing, life is slowly getting back to normal. You still see fewer cars than usual, but you do see people on the streets, and there is this telltale sign of activity.
So, Anna, when you talk about those levels being changed there, what does that mean in practical terms?
It means that they feel that they're getting a handle on the situation, and that's reflected in the numbers. As you were saying earlier, the number of new cases in China has been dropping steadily over the last few days. It's too early to call that everything has plateaued, but it does seem that the efforts by the Chinese government, very aggressive by most standards, have in fact been working. This was echoed by the WHO, the senior official who was here in China, had a press conference yesterday in which he said that he didn't previously believe that these kind of physical quarantine measures would work, but he had changed his mind based on what China had been able to accomplish.
All right, let's bring in James Chow. James Chow in Hong Kong. You are a Goodwill Ambassador for the WHO. They have been in Wuhan. They've been working with local officials and local medical personnel down there to see how the quarantine and the lockdown has been working. What is their assessment right now?
Well, the assessment right now has always been that international travel restrictions there's limited effectiveness as to what this can do. But in terms of China's capacity to manage this health emergency there internally, there's been very strong words of support for it, that the government moved when it did move very quickly and then took actions, as Ina said just then, may have come across as very tough for others. But at the end of the day, it was successful, and it appears to be getting successful in containing the outbreak, and in so doing, delaying the spillover of the outbreak outside of its own borders into the rest of the world, giving the world an opportunity to get prepared. And as we wait for the US response in the next hour, that's something that's concerning to me. Did we make the best use of the last 4 to 6 weeks to really get prepared around the world? Or was everybody just watching and seeing what was happening in China? My concern is that everyone got very tangled up in the words pandemic or whether we should have called a global health emergency earlier than it was. But I think what's really important now is that you really seize this narrowing window of opportunity, as Dr. Tedros has said, and get prepared now. It's never quite too late, but that time gap keeps narrowing as each day goes by.
James, of course, we have outbreaks in other parts of the world right now, or people infected in other parts of the world. Does the WHO remain the body through which China is coordinating its worldwide efforts with other countries?
Absolutely. They were very active, for example, during the Science and R&D Funders meeting that took place about 3 weeks ago under Dr. Tedros and Dr. Sumia, the chief scientist. It has a joint WHO-China mission, which is based in China itself, reporting with Geneva. And when it goes through Geneva and the World Health Organization, it's not only to the organization itself, it goes to all 190 plus member states. It's not only working with the WHO as a technical and humanitarian agency, but with all its member states under that umbrella.
All right, Chris Smith, we now have a very interesting situation developing in Brazil. We have a case of the virus being reported from Brazil. It was a man who traveled from Italy to Brazil. He was found to be carrying the virus. This is what the Brazilian Minister of Health had to say about that. Let's watch this.
So in the southern hemisphere, we're going to see how these viruses will behave in a tropical country. In the middle of the summer, we'll see what the pattern of behavior will be. It's a new virus, so it could maintain the same pattern of behavior that it has had in the northern hemisphere, where you basically have the cold, the temperature as a factor.
So, Chris, we now have the situation where the virus is in a different environment. It's in a summer environment where it's warmer right now. What will researchers and scientists and doctors be looking for?
I think I agree with him, although one has to bear in mind that Australia has also had some cases too, and it's pretty warm there at the moment. But no, he's quite right. A lot of the approaches that are being taken in Northern Hemisphere countries, including the UK where I am, is to try to delay the surge in virus cases into the spring and summer months. And the rationale behind that is that viruses do spread less well in summertime. And the number of reasons for that, but the chief one is that people spend more time outside when the weather's nice and less time cooped up indoors. The windows spend more time open in summertime, so you don't end up recycling dirty, virus-laden air. And there's also more ultraviolet light, and that helps to destroy viruses. And that's why he's saying it'll be interesting to see what happens when this enters a tropical domain, because there are all those factors already present all the time there. What's different, though, is that, of course, this country, Brazil, it's quite poor. The economy hasn't been doing quite so well recently, and the healthcare system isn't great. And they've had problems with other natural infections like Zika virus recently as well, which have also caused some pressure. So it will indeed be very interesting to see what the outcomes are, but one must not take one's eye off the ball. We're now seeing big numbers of cases in other countries in the Northern Hemisphere, such as Italy, and obviously one has to keep an eye on that, because although China may be saying it's great, the numbers are going down in China, actually the fires are now beginning to burn in other places.
So, Chris, just to get some clarity on this, what researchers and scientists will be looking for is not whether the virus can survive or not survive in a warmer climate or warmer weather, but the fact that it may not be able to spread as fast in warmer conditions.
Yeah, the figures we have at the moment are based, obviously there's a lot of data from China. There are some other papers now beginning to emerge where there have been outbreaks, for instance, on the cruise ship in Japan, and this is giving us a bit more clarity. And we're computing values which are referred to as the reproduction number, or the R0 value. And what that number means is for every case, how many new cases do you get for every case? And we know that the value seen in the Northern Hemisphere, in China, for example, for this new agent is about 3 or 4. That's 3 or 4 new cases for every single case that we already have. Now, the problem with that is that that means that it's spreading quite quickly, because it's roughly twice as easy for it to spread as the flu. But in the southern hemisphere in the summertime, will that number change? And that's why it's going to be really interesting to follow up cases there, if there are any more, and if there is an outbreak there, to see if that R0 number is the same.
All right, let's bring it to the studio, to Catherine. Catherine, the U.S. Centers for Disease Control says this could be on the verge of a pandemic, which would be a worldwide spread of the disease. There are now 15 confirmed cases in the United States. This is what the principal deputy director at the CDC had to say. Let's watch this.
Current global circumstances suggest it's likely that this virus will cause a pandemic. In that case, risk assessment would be different, and new strategies tailored to local circumstances would need to be implemented to blunt the impact of the disease and further slow the spread of the virus. Now, it's not so much a question of if this will happen anymore, but rather more a question of exactly when this will happen and how many people in this country will become infected.
So, in fact, we will have President Trump talking about the coronavirus outbreak in about 20 minutes. But listening to what the CDC Deputy Director had to say there, how prepared is the U.S. to deal with this virus?
So right now, we still are mostly just seeing cases in travelers, and then a few people who had close contact. We are not yet seeing sustained local transmission. Mm-hmm. What they're saying is that it's becoming more likely that we will see that, and there are plans that have been developed that we'll put into place at that time. The particulars of what those plans will look like, though, are going to need to be tailored to the specifics. So unfortunately, what they're telling us with that is there's not one plan where they can say this is exactly what we're going to do when we start having cases locally. They're saying we have a lot of plans, something will go into place that's appropriate, but we're going to have to wait and see how this unfolds. That's a little tricky because a lot of people are saying, what can we as individuals do to be prepared? And the message right now is we're still waiting to see how this unfolds here in the U.S.
Yeah, but shouldn't they have been ready with those plans already? I mean, this has been going on for weeks.
Right, so there are lots of plans that have been in place for years that would say when there are these kinds of things that happen, we would close schools, we would limit travel. Those plans are in place generally, but the specifics about who's involved, was this a traveler with just neighbors and family who were affected, or is this something where someone used public transportation and was in a public space and it could be more widespread? The particular measures that would be implemented have to be tailored to that circumstance.
We hear much being said about testing kits. What are these kits and are they freely available?
The big problem we have right now in the U.S. Is that we don't know what our denominator looks like. Denominator meaning what are the total number of people infected, not just symptomatic people. We have been testing return travelers, but we have not been testing people who were not known to have contact with someone who was sick from an affected area. Other countries have been testing thousands of people. The U.S. has not tested that many. The worry is that if we start testing, we are going to start to find some more cases. But of course, to say that's a worry, it's information. It lets us know how to proceed. So we'll see more tests happening, more test results coming out in the U.S. in the coming days and weeks, and that will really guide what the response is.
And one of the issues is that you can have the virus and not show any symptoms, right?
That is the biggest thing that has changed in terms of our understanding of how this might unfold over the past week. Up until about a week ago, we sort of assumed, because based on previous diseases, that's how it worked, that people would be sick, we would know they were sick, we could trace their contacts. If we have people who have no symptoms or very mild symptoms, we don't know to trace their contacts, and containing this becomes very much more difficult.
Ina Tangen, as you told us a moment ago, China is tackling this in a very aggressive way. It's pouring enormous resources into fighting the virus. Dr. Bruce Aylward, who is the head of the joint WHO-China mission, has been speaking in Geneva about China's response. This is what he had to say. Let's listen.
And one of their key points they made again and again was, we don't know what's going to happen next in China. We've got it right down like this. We think we can manage, and there will not be another Wuhan. We know how to manage this disease now in all the parts of the country. If it went to zero and disappeared, that'd be great, but that's not what they're planning for. What they're planning for is this could remain for some time, maybe some time until there's a vaccine, so we will have the capacities to be able to manage it and run society and economy and everything else the way we need to, and not lock people down to try and manage this.
So, Ina, is China preparing for the long haul here? You know, a vaccine could be months away.
China's taking appropriate actions from their perspective. You don't know. This is a novel virus. You have to be prepared on all sides. They found this out quite clearly with Wuhan. I'm a little surprised at the U.S. efforts after the criticism that was leveled against China over Wuhan of taking this very casually. It seems that it is. I mean, despite the announcement that $2.5 billion was going to fight, quote, this virus, the truth is that the CDC's funding has been cut time after time by Donald Trump. People have not been replaced. And why wouldn't they be testing at this point? It seems incredible that, the kind of hypocrisy that's involved of them saying that, China took this lightly to begin with, and that's why it's all been a problem, and now doing exactly the same thing.
James Chow, how prepared is China for this outbreak, which, as we're hearing, could go well into this year?
Well, I think that is, first of all, to be very honest, it's very hard to spot an epidemic. So, this is occurring during the height of a seasonal flu. So it's not always easy. But I think for China, what's going to be key is to work with partners like WHO, but also with very sophisticated US CDC, for example, over in Atlanta, to understand further the epidemiology. Until they do that, it's very hard to fully establish, for example, the existing therapies that could be innovated to treat and save lives right now, but on top of that, to create a vaccine. Now, the vaccine, you said, could be many months away. It could be years away. It might never actually happen. There was no vaccine created for SARS, for example. There are limited therapies available even for Ebola. But now that this virus is seen to be spreading around the world, this is no longer like Ebola. It's not something which is isolated in a couple of countries in West Africa. It's coming into mainstream leading world economies. And I think that's what's got people very worried over here. If I was in the position of a country that is bracing for an outbreak possibly on their soil, what I would be doing is making sure that the health workers, first and foremost, are protected. When you protect your health workers, you're protecting your communities. And what I'd also be doing, and I hope that China does this as well, is to allow community to be mobilized and to help lead on the response. That's what we learned from AIDS 39 years ago. When you get the people involved, you see a turnaround. You need clear and you need consistent political advisory from leadership, from governments. And if you don't do that, people are going to get confused and start taking their own advice, whichever way that leads them to.
It certainly is spreading very quickly. Chris Smith, we now know that at least 38 other countries are now dealing with coronavirus. We've heard infections on the rise in Iran, Italy, and South Korea. What is your assessment? Could this get a lot worse before we see a turn?
Actually, this is kind of what I expected. And the last time we were all together on this program, excuse me, not coronavirus yet, I did say that we should be prepared for the fact that we're going to see more cases. And the fact is that there were thousands of people flying out of various parts of China for many weeks until they finally stopped the travel, which means, based on the numbers we have, there were probably very large numbers of people travelling with this infection all over the world. And although there are some areas in the world that currently look like they don't have any infection, haven't declared any numbers, many of them are just not doing any testing. And for instance, here in the UK, it's only in the last week or so that we've had information come through from Public Health England to suggest that laboratories will now start doing what we call sentinel testing. Now, what that means is that rather than just have a very strict case definition, have you been to one of 9 territories where we know this virus is circulating? Have you got a temperature? Have you got the symptoms that are consistent with this? Or have you been in contact with someone recently who has? Rather than that, we're now beginning to take samples from, in just 8 centres in England and then 4 others in Scotland, Wales and Ireland. We're actually testing people who are in intensive care with sudden unexplained lung problems. And that's to give us some idea as to whether they may be suffering with this infection. That's called sentinel analysis. But what we're not doing is looking in the general population, because we don't have the capacity, and we think that at the moment the numbers are going to be quite low. But even if they are, that could be the start of this beginning to ramp up. Other countries are not even doing that. So at the moment, what may look like reassuringly low numbers in some places may just be for want of testing.
Chris, there was another interesting point that James Chow just raised, and that is the preparations that countries are making in case this virus, or the countries that already have cases of this virus being there, things like protecting health workers. I mean, do these countries have the necessary infrastructure in place to deal with this outbreak?
It varies. And one of the points that I made in an interview, a bit like this one, when Ebola happened, was that actually, rather than just obsess about Ebola, what we need to do is to consider what Ebola is going to do to the healthcare infrastructure in the affected countries, because that will rob those countries of already what they had, which is a pretty parlous delivery of healthcare. And the consequences for people dying of things other than Ebola may well be worse. Indeed, that was what turned out to happen. We've seen, in fact, more people dying from malaria subsequent to Ebola because of devastation to the healthcare system than actually died of Ebola. So there is therefore the potential, certainly in resource-poor countries, for existing fairly poor healthcare systems to be overwhelmed if they do see a sudden surge in numbers. There's also the possibility for quite well-resourced countries, such as the UK, to be similarly overwhelmed. I did a simple sort of telephone call today to a number of places, hospitals, asking them if you had patients who needed ventilating tomorrow, as in people with severe lung infection, and they needed to be on supplemental oxygen and then have a machine breathe for them, how many people could you accommodate? And the answers are single numbers in some hospitals to just a few tens of patients in other very large hospitals. So in other words, very quickly, systems, even in first world countries, could become overwhelmed. So it's going to vary by country, it's going to vary by how hard hit that country is, and at the moment we just don't know. So the bottom line is people are planning for the worst, but they're hoping for the best.
Catherine, on those things that Chris was talking about, things like ventilators, how prepared is the US?
It, like in every other country, varies quite a bit, where certain urban areas may be more equipped than rural areas. And it's not just about having a health system in the medical sense that's prepared, it's also about public health and to what extent city and county and state health departments are prepared. The CDC will issue very good direct guidance to those units, but this is an all hands on deck kind of situation.
Right. You know, we had a situation not so long ago where the United States was diverting all flights from China to just about half a dozen specific airports where people were being checked, where they were being screened. But now that we see the virus appear in other parts of the world, what happens next? Does the U.S. start screening all flights coming in?
Probably not. Just logistically, this test is expensive. It's hard to do. We're not going to be able to make that work. As this becomes a pandemic, that is the complexity for every country. We aren't probably going to start saying no flights from Italy, no flights from South Korea, no flights from Japan, and wherever else this happens to show up. At a certain point, we say this is out there, and we can't just target one country or the other.
Anna Tangen, of course, this coronavirus outbreak is having all kinds of effects on China and around the world. We've talked about the economic effects, but the Chinese government also has postponed its annual political meetings known as Two Sessions. These are the meetings of China's top lawmakers and policy advisors. What should we read into that? How significant is that, the fact that it's been postponed?
Well, you shouldn't read anything politically into it. It's a logistical nightmare because you're literally bringing people from every single area of China, thousands of them, to Beijing and then sending them back home. This would be foolish at this point. And I think the government wants to send a very strong message that they're looking at the means and methods by which they're dealing with this virus. They're not making speeches, they're simply giving information. And I think this is part of a very effective approach. They need to make sure that the people understand that they're being transparent, that they're giving the information that is necessary for the public, everything that James and my other colleagues have talked about in terms of public health, they are trying to do. Everywhere I go in Beijing, there's notes in the elevators, only 4 people allowed, everything is wiped down every half hour, buildings are disinfected twice a day. These are the types of things that are necessary to do it, and it's been effective for China. The question is, will other countries adopt this kind of approach? Because you can say that you can't afford to do testing and these things, but can you afford the economic consequences that would come as a result of not doing it?
Well, as we've been reporting, the city of Wuhan, which is home to 9 million people, is still under quarantine. There has been a drop in cases in that city. This is a report we have from our correspondent in that city, Zhao Yunfei.
Wuhan has undergone strict ever quarantine measurements, and each household only have one quota every 3 days to send one member to go out of their community and buy all the necessities. This is the measurement being taken after a all-scale door-to-door screening, measurements being taken to reduce human-to-human interactions and to further contain the spreading of the coronavirus. Meanwhile, WHO and China Joint Research Group have met the press and briefed the media about the situation. The average age of the patient is 51, and they're still looking for the source and host of the coronavirus. Because the virus is so novel, people don't have immunity to the virus, but the good thing is there's no significant sign of mutation to the virus. The WHO paid a visit to Wuhan, the epicenter of the coronavirus outbreak. They paid a visit to an airport, a local hospital, and a temporary hospital to see China's measurement in contain the virus. Previously, WHO has always been praising China's measurements to ensure the security of the entire world by giving out details of the information of the patients as well as submitting the sequence of the virus. So far, Wuhan has already speeded up its testing procedure, meaning that all the suspected cases, if they got tested, they can see the result by the end of the day, and they are also boosting the capacity of beds, and there have already been more beds than patients. Zhao Yunfei, CGTN, Wuhan, Hubei Province.
You know, James Cha, as we've been hearing there, you know, this virus has changed the way people go about their daily lives, not just in Hubei Province, but in other parts of China as well, in other parts of the world as well. What are you seeing in a city like Hong Kong?
Well, that's very interesting. I mean, you know, we've had the experience, the first-hand experience of SARS. I was here at the time during SARS, and so in a way, that's where places like Hong Kong and Beijing have a quote-unquote unfortunate head start on the rest of the world. But still, I don't think that it was prepared in the sense that there wasn't a significant stockpile of masks that led to panic buying. There is a mistrust, as we know, among certain communities, in institutions and governments, and that's not only unique to where I am right now, but around the world. And when you see that, that's when you begin to see control measures not necessarily having the effect that they're designed to have in the first place. Over the past couple of weeks, I think 90% of the time, I'm at home, I come out to the studio, I go down to buy groceries because I don't want other members of my family to be exposed to that risk if they have other pre-existing conditions or if they're in an older age bracket. So in that sense, it has been difficult. Offices are still closed. We hear that civil servants will be returning to their offices for the first time since before the Chinese New Year next Monday. I'm not quite sure that's been fully confirmed yet, and it'll be interesting to see whether private sector businesses choose to follow that government lead or whether they decide to hold back and continue the work from home arrangement that people have been on for many weeks now. But it slows down the economy, it slows retail. There's a general fear. People who can afford to, who are already away over the Chinese New Year on their vacations, have stayed away in places like Europe and the United States. And it'll be interesting as well whether they choose to return back here to China, whether they're going to stay outside still where the virus appears to be spreading to.
Right, Catherine, let's talk about a vaccine. There is a race on to get this vaccine going, but it could take a long time, couldn't it?
It will take a long time.
Yeah.
So it's relatively easy now. It's still really difficult, but it's relatively easy in a lab to make a candidate vaccine. It still then has to go through lots of phases of testing to make sure that it works, to make sure that it's safe. That takes months. So even if we'd already invented the vaccine, it would be 7, 9 months, maybe longer, but we probably don't have that vaccine yet. It usually takes dozens or even hundreds of candidate vaccines to find one that works well enough to put it into manufacturing and distribution.
And when it's tested, Catherine, what I understand is that it's initially tested on a small group, but as you get into the second, third, fourth, the groups get a lot bigger.
Right, so a phase 1 trial might be in 80 or 100 people,
Yeah.
then a phase 2 trial would be several hundred, and then a phase 3 trial would be several thousand. And the idea there is to make sure that we're really testing for safety at every step. We don't want to create a vaccine that causes harm.
Right, and just to be clear about something, a vaccine will stop new infections, but it won't do anything about people who are currently infected.
Right, well, especially right now when we don't have a vaccine.
yeah.
But the expectation is that when there is a vaccine, it would not be the type of vaccine that once people are infected, the vaccine prevents them from becoming symptomatic. We assume that the vaccine would be one that would help slow transmission between people. That could become very helpful if we have, as seems to be the case, something where asymptomatic people are transmitting it. If we can't see the infections, we can't stop it, but a vaccine where we vaccinate large numbers of people would slow that down. But again, we're talking at least a year out till we would get to that point.
Yeah, that's right. In fact, the director of the National Institute of Allergy and Infectious Diseases, Dr. Anthony Fauci, he was saying it could be a year to a year and a half.
Yes, at least. And that would assume that we found a good candidate relatively fast. Right. So we do need to invest in vaccine development now, but that doesn't mean an instant vaccine.
Yeah. Anna Tangen, of course, as we talk about the impact this virus is having on people's health, it's also having an effect on the economy of China as well as economies. There's a global impact on this. The main U.S. stock market in New York, it's taken a bit of a bashing over the last 2 days. The FTSE in London also took a beating. And, you know, we have to remember that China is the world's second biggest economy and also a key link in the global supply chain. How is this outbreak affecting China's economy?
Well, it's been very disastrous. If you're in the car industry, it's down 92%, as you would expect, since people are not going out. In a lot of areas like that, the Chinese government is projecting that it'll be a V type of recovery. This is similar to what happened at SARS. What you had is during the months of infection, things went down dramatically and then went up dramatically thereafter as people delayed decisions. But, you know, things are a little bit different today than they were back then. China is 4 times the size of, its economy is 4 times the size it was in 2003, and it's much more dependent, over 50%, on consumption. And consumption is a little bit harder to recover because you're not going to buy 2 or 3 sandwiches today because tomorrow because you didn't have one today. Things like tourism, air travel, hotels, etc. These are being hit extremely hard because once the money is gone, it's not easily recovered. They're hoping that there will be a delayed sense of people taking vacations they weren't otherwise able to have. Spending money that they've been saving since they've been living very frugally, but it's not clear that it is. But what this has done has ripped the curtain away from this notion that the world is not connected. If you're anywhere in the world today, you will suddenly realize, consumers and businesses alike, that the world is totally interconnected, that this global supply chain, which has been growing since the early 2000 period, has now connected us all, and that something that harms one area is going to have effects in another. So this is one good argument for somebody who's approaching this rationally to understand that you cannot do this decoupling without extreme amounts of economic displacement and hardship.
Catherine, if this is designated a pandemic, what changes?
Not much, in that that's a word,
so it's just a label.
Designation. It's just a label.
Yeah.
We already have every country on standby because it's a public health emergency of international concern. And where this plays out, pandemic doesn't mean it's every single country. It means it's widespread. So the countries that are affected are going to have to respond whether it's declared to be a pandemic or not.
It doesn't give medical authorities more power, or does it unlock more money?
That designation doesn't really. Certainly, the more concerned the global community is about it, the more resources that we'll be devoting to it, whether there's a name on it or not.
Chris, what is your view on that? If it's a pandemic, I mean, as Catherine says, it doesn't force countries to unlock more money or give medical authorities more power, but what would that mean?
It's a word which actually has a pretty poor definition, and the loose definition is when we say something is a pandemic, that lots of people in lots of different parts of the earth are being affected. It's pretty loose. But what it does do is it tends to upset people and worry people because, of course, it has connotations of the 1918 Spanish flu pandemic with tens of millions of people succumbing to that around the world. And I think people are trying to avoid using the term, not because it doesn't fit, because I think actually we already are in a situation where you could say, well, this probably is a pandemic. I think they're not using the term because they don't want to panic people.
And James Shaw, I guess this is when the work of the WHO becomes very important, educating people around the world on what this means and what's going on.
Well, I think one question is educating people. The second thing, Arne, and I'm sure you agree, is whether people choose to accept that with their minds and their hearts as well. And I was wondering, coming to the studio today, why we're seeing a sudden uptick in media interest in the last, say, even 12 hours, since when we went to bed in Hong Kong to we waking up here this morning. And I think it really is a reaction to how the stock markets have been performing. That to me is still slightly disappointing and shocking somewhat, that we somehow feel that the health of our economies is more important than the health of our own people, when in fact the health of our people is going to shape the health of our economies all the way around the world. The WHO has put out a clarion call for $675 million in funding to help aid the response, the wider response to this new novel coronavirus. And as of now, apart from a major pledge by Bill and Melinda Gates of $100 million, plus some other significant pledges by countries including the Netherlands and also Norway and Slovakia, there's been a very, very slow pledging, let alone receiving of those funds process. And you think about it, even if it was fully funded at $675 million, that's a fantastic investment against a risk proof of trillions of dollars in the global economy. So has the world really learned? I don't really think so. And I'd add one more thing over here. This call for preparedness for the next global health emergency is not new. In a sense, as Chris said there, it's been there since 1918, when about 500 million people possibly were infected around the world with that influenza. And even last September, we were in New York with Gro Harlem Brundtland, with El Hajjasi, and they made a very, very clear warning that the world stands at acute risk of disease epidemics and pandemics that will not only devastate health systems, but also upend economies and create social chaos around the world. So even back in September, as recently as that, even as far back as 4 whole weeks ago, I don't think people really have really responded to that as they should have been.
Anna Tangen, how important is it that money starts coming through?
I'm sorry, I didn't hear your question.
How important is it that the money that's needed to counter this virus, that starts coming through?
Well, it's very important in terms of actively, but let's be clear. I'm not criticizing the CDC. It's one of the foremost institutions of its type in the world. What I'm criticizing are the policymakers themselves, who have consistently cut the amount of money.
Yeah, Anna, I'm sorry, I have to interrupt you. President Trump is now speaking. Let's go to the White House.
Thank you very much, everybody. Thank you very much. Before I begin, I'd like to extend my deepest condolences to the victims and families in Milwaukee, Wisconsin. Earlier today, a wicked murderer opened fire at a Molson Coors Brewing Company plant, taking the lives of 5 people. A number of people were wounded, some badly wounded. Our hearts break for them and their loved ones. We send our condolences. We'll be with them. And it's a terrible thing, terrible thing. So our hearts go out to the people of Wisconsin and to the families. Thank you very much. I've just received another briefing from a great group of talented people on the virus that is going around to various parts of the world. We have, through some very good early decisions that were actually ridiculed at the beginning, we closed up our borders to flights coming in from certain areas, areas that were hit by the coronavirus and hit pretty hard. And we did it very early. A lot of people thought we shouldn't have done it that early, and we did, and it turned out to be a very good thing. And the #1 priority from our standpoint is the health and safety of the American people, and that's the way I viewed it when I made that decision. Because of all we've done, the risk to the American people remains very low. And we have the greatest experts in the world, really in the world, right here. The people that are called upon by other countries when things like this happen. We're ready to adapt, and we're ready to do whatever we have to as the disease spreads, if it spreads. As most of you know, the the level that we've had in our country is very low, and those people are getting better, or we think that in almost all cases, the better are getting. We have a total of 15. We took in some from Japan. You heard about that, because they're American citizens and they're in quarantine. And they're getting better too, but we felt we had an obligation to do that. It could have been as many as 42, and we found that it was just an obligation we felt that we had. We could have left them, and that would have been very bad, I think, American people. And they're recovering. Of the 15 people, the original 15, as I call them, 8 of them have returned to their homes, to stay in their homes until fully recovered. 1 is in the hospital, and 5 have fully recovered, and 1 is, we think, in pretty good shape, and it's in between hospital and going home. So we have a total of 15 people, and they're in a process of recovering, with some already having fully recovered. We started out by looking at certain things. We've been working with the Hill very, very carefully, very strongly, and I think we have very good bipartisan spirit for money. We were asking for $2.5 billion, and we think that's a lot, but the Democrats and I guess Senator Schumer wants us to have much more than that. And normally in life, I'd say, we'll take it. We'll take it. If they want to give more, we'll do more. We're going to spend whatever's appropriate. Hopefully, we're not going to have to spend so much, because we really think we've done a great job in keeping it down to a minimum. And again, we've had tremendous success beyond what people would have thought. Now, at the same time, you do have some outbreaks in some countries. Italy and various countries are having some difficulty. China, you know about where it started. I spoke with President Xi. We had a great talk. He's working very hard, I have to say. He's working very, very hard. And if you can count on the reports coming out of China, that spread has gone down quite a bit. The infection seems to have gone down over the last 2 days. As opposed to getting larger, it's actually gotten smaller. In one instance where we think it's somewhat reliable, it seems to have gotten quite a bit smaller. With respect to the money that's being negotiated, they can do whatever they want. I mean, we'll do the 2.5. We're requesting 2.5. Some Republicans would like us to get 4, and some Democrats would like us to get 8.5, and we'll be satisfied whatever it is. We're bringing in a specialist, very highly regarded specialist, tomorrow, who works actually at the State Department, very, very tremendously talented in doing this. I want you to understand something that shocked me when I saw it, that I spoke with Dr. Fauci on this, and I was really amazed, and I think most people are amazed to hear it. The flu in our country kills from 25,000 people to 69,000 people a year. That was shocking to me. And so far, if you look at what we have with the 15 people, and they're recovering, one is pretty sick, but hopefully will recover. But the others are in great shape. But think of that, 25,000 to 69,000. Over the last 10 years, we've lost 360,000. These are people that have died from the flu, from what we call the flu. Hey, did you get your flu shot? And now what we've done is we've stopped non-U.S. citizens from coming into America from China. That was done very early on. We're screening people, and we have been at a very high level, screening people coming into the country from infected areas. We have in quarantine those infected and those at risk. We have a lot of great quarantine facilities. We're rapidly developing a vaccine, and they can speak to you. The professionals can speak to you about that. The vaccine is coming along well, and in speaking to the doctors, we think this is something that we can develop fairly rapidly, a vaccine for the future, and coordinate with the support of our partners. We have great relationships with all of the countries that we're talking about. Some fairly large number of countries. Some it's one person, and many countries have no problem whatsoever. And we'll see what happens. But we're very, very ready for this, for anything, whether it's going to be a breakout of larger proportions or whether or not we're, we're at that very low level. And we want to keep it that way. So we're at the low level. As they get better, we take them off the list so that we're going to be pretty soon at only 5 people. And we could be at just 1 or 2 people over the next short period of time. So we've had very good luck. The Johns Hopkins, I guess it is a highly respected, great place. They did a study, comprehensive, the countries best and worst prepared for an epidemic. And the United States is now, we're rated #1. We're rated #1 for being prepared. This is a list of different countries. I don't want to get in your way, especially since you do such a good job. This is a list of the different countries. The United States is rated #1, most prepared. United Kingdom, Netherlands, Australia, Canada, Thailand, Sweden, Denmark, South Korea, Finland. This is a list of the best rated countries in the world by Johns Hopkins. We're doing something else that's important to me because he's been terrific in many ways, but he's also very good on health care. And we really followed him very closely. A lot of states do. When Mike was governor, Mike Pence of Indiana, they've established great health care. They have a great system there, a system that a lot of the other states have really looked to and changed their systems. They wanted to base it on the Indiana system. He's very good. And I think, and he's really very expert at the field. And what I've done is I'm going to be announcing exactly right now that I'm going to be putting our Vice President, Mike Pence, in charge. And Mike will be working with the professionals, doctors, and everybody else that's working. The team is brilliant. I spent a lot of time with the team over the last couple of weeks, but they're totally brilliant, and we're doing really well. And Mike is going to be in charge, and Mike will report back to me. But he's got a certain talent for this, and I'm going to ask Mike Pence to say a few words, please. Thank you, Mike.
Thank you, Mr. President. President Trump's made clear from the first days of this administration we have no higher priority than the safety, security, health, and well-being of the American people. And from the first word of an outbreak of the coronavirus, the President took unprecedented steps to protect the American people from the spread of this disease. He recounted those briefly, but the establishment of travel restrictions, aggressive quarantine effort of Americans that are returning, declaration of a public health emergency, and establishing the White House Corona Task Force are all reflective of the urgency that the President has brought to a whole-of-government approach. As a former governor from the state where the first MERS case emerged in 2014, I know full well the importance of presidential leadership, the importance of administration leadership, and the vital role of partnerships of state and local governments and health authorities in responding to the potential threat of dangerous infectious diseases. And I look forward, Mr. President, to serving in this role, bringing together all the members of the Corona Task Force that you've established, HHS, CDC, DHS, the Department of Transportation, and state. This team has been, at your direction, Mr. President, meeting every day since it was established. My role will be to continue to bring that team together, to bring to the President the best options for action to see to the safety and well-being and health of the American people. We'll also be continuing to reach out to governors, state and local officials. In fact, in the recent days, the White House met with over 40 state, county, and city health officials from over 30 states and territories to discuss how to respond to this, to the potential threat of the coronavirus. We'll be working with them in renewed ways to make sure they have the resources to be able to respond. And as the President said, we'll be adding additional personnel here at the White House to support our efforts on the President's behalf. We'll also be working with members of Congress to ensure that the resources are available for this whole of government response, and we'll be working very closely with Secretary Azar and his team that have done an outstanding job communicating to the public to ensure the American people have the best information on ways to protect themselves and their families, and also that the public has the most timely information on the potential threat to the American people. Mr. President, as we've been briefed, while the threat to the American public remains low of a spread of the coronavirus, you have directed this team to take all steps necessary to continue to ensure the health and well-being of the American people. And the people of this country can be confident that under your leadership, we will continue to bring the full resources of the federal government in coordination with our state and local partners to see to the health and well-being and to the effective response to the coronavirus here in the United States of America. With that, the President's asked me to recognize the Secretary of Health and Human Services, Alex Azar, and also the Deputy Director of CDC, Dr. Ann Shaka, for remarks. Secretary.
Well, thank you, Mr. Vice President, and thank you, Mr. President, for gathering your public health experts here today and for your strong leadership in keeping America safe. And I just want to say I could not be more delighted that you've asked the Vice President, my old friend and colleague, to lead this whole of government approach with us under the Emergency Support Function number 8. As of today, we have 15 cases of COVID-19 that have been detected in the United States, with only one new case detected in the last 2 weeks. We also have 3 cases among Americans repatriated from Wuhan and 42 cases among Americans repatriated who had been stuck on the Diamond Princess in Japan. The President's early and decisive actions, including travel restrictions, have succeeded in buying us incredibly valuable time. This has helped us contain the spread of the virus, handle the cases that we have, and prepare for the possibility that we will need to mitigate broader spread of infections within the United States. The President's actions, taken with the strong support of his scientific advisors, have proven to be appropriate, wise, and well calibrated to the situation. We're grateful for the hard work that healthcare workers, first responders, communities, state and local leaders have put into the response so far. Because of this hard work and the President's leadership, the immediate risk to the American public has been and continues to be low. Our containment strategy has been working. At the same time, what every one of our experts and leaders have been saying for more than a month now remains true. The degree of risk has the potential to change quickly, and we can expect to see more cases in the United States. That is why we've been reminding the American public and our state, local, and private sector partners that they should be aware of what a broader response would look like. CDC has recommended that the American public, and especially state and local governments, businesses, and other organizations, should refresh themselves on how they would respond in the event that the situation worsens. We're encouraging Americans to learn what future steps might be necessary to keep themselves and their communities safe. Knowing these potential steps now can help keep the risk to you and your community low. Americans can find useful information at cdc.gov/COVID-19. And we're working closely with government and private sector partners to educate them about preparedness. Finally, we've begun working with Congress to secure the funding that we need. There are 5 major priorities in the White House request to Congress that the White House made on Monday. These priorities are: first, expanding our surveillance network; second, support for state and local governments work; third and fourth, development of therapeutics and vaccines; and fifth, manufacturing and purchase of personal protective equipment like gowns and masks. As chairman of the President's Coronavirus Task Force, I'm committed to providing regular updates from our coordinated interagency process. We've had our top public health leaders, like those joining me here today, speaking to the media many times per day to inform the American public. The Trump administration is going to continue to be aggressively transparent, keeping the American people and the media apprised of the situation and what everyone can do. With that, I'm going to hand things over to Dr. Ann Schuchat. Dr. Schuchat is the senior career official at the Centers for Disease Control and Prevention, the principal deputy director, with an over 30-year career at the CDC in public health and as a member of the United States Public Health Service Commission Corps. So, Dr. Schuchat, I'll turn it over to you.
Thanks so much, Mr. Secretary. As you know, this has been a difficult and challenging time, and our hearts go out to the individuals who have been directly affected by the virus and to all those who have been working tirelessly in responding to it. Our aggressive containment strategy here in the United States has been working and is responsible for the low levels of cases that we have so far. However, we do expect more cases, and this is a good time to prepare. As you heard, it's the perfect time for businesses, healthcare systems, universities, and schools to look at their pandemic preparedness plans, dust them off, and make sure that they're ready. And we have lots more information at the CDC's website and in partnership on how to do that. But it's also a really good time for the American public to prepare and for you to know what this means for you. The coronavirus that we're talking about is a respiratory virus. It's spread in a similar way to the common cold or to influenza. It's spread through coughs and sneezes. And so those everyday sensible measures that we tell people to do every year with the flu are important here. Covering your cough, staying home when you're sick, and washing your hands. Tried and true, not very exciting measures, but really important ways that you can prevent the spread of respiratory viruses. So the trajectory of what we're looking at over the weeks and months ahead is very uncertain, but many of the steps that we have taken over the past 15 years to prepare for pandemic influenza and our experience going through the 2009 H1N1 pandemic of influenza remind us of the kinds of steps that our healthcare system, our businesses, our communities and schools may need to take. We're in this together, all of government, the public and the private sector, and the CDC wants to make sure you have the best information available every day. Thank you.
I just want to give you a very quick update on the my name is Dr. Tony Fauci. I'm the director of the National Institute of Allergy and Infectious Diseases at NIH. Just a very quick update on the countermeasure development in the form of vaccines and therapeutics. I had told this audience at a recent press briefing that we have a number of vaccine candidates and one prototype one to give you a feel for the time frame of a vaccine and what its impact might be now and in subsequent years. Is that I told you we would have a vaccine that we would be putting into trials to see if it's safe and if it induces a response that you would predict would be protective in about 3 months. I think it's going to be a little bit less than that. It's probably going to be closer to 2 months. That would then take about 3 months to determine if it's safe and immunogenic, which gives us 6 months. Then you graduate from a trial, which is phase 1 of 45 people, to a trial that involves hundreds, if not low thousands of people to determine efficacy. At the earliest, an efficacy trial would take an additional 6 to 8 months. So although this is the fastest we have ever gone from a sequence of a virus to a trial, it still would not be any applicable to the epidemic unless we really wait about a year to a year and a half. Now, that means 2 things. One, the answer to containing is public health measures. We can't rely on a vaccine over the next several months to a year. However, if this virus, which we have every reason to believe it is quite conceivable that it will happen, will go beyond just a season and come back and recycle next year. If that's the case, we hope to have a vaccine. And then finally and briefly, therapeutics. There are a number of antiviral drugs that are being tested. A few days ago, we initiated a randomized controlled trial of a drug called remdesivir, which has antiviral activity in vitro in an animal model. The good news about that is that it's a trial that's randomized to either placebo or standard of care, and drug and standard of care, which means that we will know reasonably soon whether it works. And if it does, we will then have an effective therapy to distribute. Thank you.
Thank you very much, Mr. President. First of all, you have just come from a long and busy trip from India. And as far as this coronavirus is concerned, you have a great scientific and medical team behind you and with you, and I'm sure they will keep America safe. As far as your trip to India, Mr. President, where do we go from here as far as U.S.-India relations are concerned? And also, Mr. President, you are very famous in India, and Prime Minister Modi is very famous in America. What is the future? And Indian-American community is with you, Mr. President.
Yeah, we won't talk too much about that other than I just got back. Long flight. He's a great gentleman, a great leader. It's an incredible country. We were treated very, very well, and we really enjoyed it. A lot of tremendous progress was made in terms of relationship. Our relationship with India is extraordinary right now, and we're going to be doing a lot of business with India. They're sending billions and billions of dollars now to the United States. But we'd rather talk about this right now.
The CDC said yesterday that they believe it's inevitable that the virus will spread in the United States, and it's not a question of if, but when. Do you agree with that assessment?
Well, I don't think it's inevitable. It probably will. It possibly will. It could be at a very small level, or it could be at a larger level. Whatever happens, we're totally prepared. We have the best people in the world. You see that from the study. We have the best prepared people, the best people in the world. Congress is willing to give us much more than we're even asking for. That's nice for a change. But we are totally ready, willing, and able. It's a term that we use. It's ready, willing, and able. And we have. It's going to be very well under control. Now, it may get bigger, it may get a little bigger, it may not get bigger at all. We'll see what happens. But regardless of what happens, we're totally prepared. Please.
President, you talked a little earlier about the screening measures that you put in place and the travel restrictions you put in place regarding China. At this point, as the virus spreads in Italy and South Korea, are you planning on adding those countries?
Well, just so you understand, I'm the president of the United States. I'm not the president of other countries. Other countries, some are on the list that are very respected in what they do in terms of what we're talking about. But I really want to be responsible for this country if it means placing a very strong situation on the border so people can't come into our country from a country that is infected. We're doing that, and we've already done it with numerous countries. But we have to focus on this country. I don't think it's right to impose ourselves on others. But if others aren't taking care, or we think they're doing it incorrectly, we're dealing with World Health, and we have terrific people, and CDC does go around and help other countries, give them recommendations as what to do. But they're working on their countries, and we're working on our countries. And so far, from our standpoint, it's really worked out very well.
Just to follow up on Steve's question, can you clarify, are you considering restricting travel to and from South Korea, Italy, and other countries that have been affected?
At a right time, we may do that. Right now, it's not the right time, but at a right time. And we are checking people as they come through, specifically for the problem that we're dealing with. So we're checking a lot of people if they're coming from South Korea's been hit pretty hard. Italy's been hit pretty hard. China is obvious what's happened in China. But again, the numbers seem to be leveling off and going down in China, which is very good news. So we'll see what happens.
White House has spent the day denying that they are going to appoint a czar to run point on the coronavirus response. Today, the Secretary Azar testified that he didn't think one was necessary and they were going to run it out of HHS. And you yourself have been downplaying this. So why are you now selecting the vice president to run point on this?
Well, Mike is not his vice president. He's in the administration. But I'm having everybody report to Mike. Mike's been very good, very adept. Anybody that knows anything about healthcare, they look at the Indiana model, and it's been a very great success. It's been a tremendous model in terms of healthcare, and this is really an offshoot of that. So this isn't a czar. I don't view Mike as a czar. Mike is part of the administration, but I'm having them report to Mike. Mike will report to me. They'll also be reporting in some cases to both. I'll be going to meetings quite a bit depending on what they want to do and what message we want to get out. But we've done really an extraordinary job. When you look at a country this size, with so many people pouring in, we're the #1 in the world for people coming into a country by far. And we have a total of 15 cases, many of which, almost within a day, I will tell you, most of whom are fully recovered. I think that's really a pretty impressive mark. Now, we did take in 40 people that were Americans, and they're also recovering, but we brought them in, so I have a different group. But we felt we had an obligation to American citizens outside of the country that were trying to get back in. We thought it was very important.
Mr. President, the stock market has taken a big hit over the past few days. What can you do about that? And if the CDC is right in saying that the spread is inevitable, are you going to be dealing with stock market issues and economy issues for some time to come?
Well, I really think the stock market is something I know a lot about. I think it took a hit maybe for 2 reasons. I think they look at the people that you watched debating last night and they say if there's even a possibility that can happen. I think it really takes a hit because of that. And it certainly took a hit because of this, and I understand that also because of supply chains and various other things, and people coming in. But I think the stock market will recover. The economy is very strong. The consumer is the strongest it's ever been. Our consumers are incredible. They're incredible. That's why we're doing well, and other countries have not. Even before the virus, we're doing great. Other countries have not been doing great. Our consumer is very, very strong, very powerful economically. Yeah, please.
Mr. President, have you been presented any plans that would involve quarantining cities like we saw in China, and what would have to happen for you to take a step
We do
like
have
that?
plans of on a much larger scale, should we need that. We're working with states. We're working with virtually every state. And we do have plans on a larger scale if we need it. We don't think we're going to need it, but, you know, you always have to be prepared. And again, Congress is talking to us about funding, and we're getting far more than what we asked for, and I guess the best thing to do is take it. We'll take it.
How much money are you willing to give Congress if they're going $6
Well, we're
billion
going to
more
see,
than you
but we'll take
offered?
care of states because states are working very hard. We have hospitals in states that make rooms available, and they're building quarantine areas where you can keep people safely. We're working really well with states. It's a very big part of it. So, you know, my attitude, if Congress wants to give us the money so easy, wasn't very easy for the wall, but we got that one done. If they want to give us the money, we'll take the money and we'll just do a good job with it. Yeah, please. Go ahead.
Mr. President, should Americans be going out getting protective equipment such as masks and so forth? And if so, what is the U.S. doing to boost production of masks?
Well, we can get a lot of it. In fact, we've ordered a lot of it just in case we need it. We may not need it. You understand that. But in case we're looking at worst case scenario, we're going to be set very quickly. But I don't think we're going to ever be anywhere near that. I really don't believe that we're going to be anywhere near that. Our borders are very controlled. Our flights in from certain areas that we're talking about are very controlled. I don't think we'll ever be anywhere near that. Please go ahead.
Back to the stock market for a second. The travel-related stocks have especially been hammered here in the last couple of days. What would you say to Americans out there who right now are looking forward to the summer or the upcoming months and saying to themselves, should I make myself summer plans? Should I go travel abroad?
Well, hopefully they're going to be able to do that. We hope that it's going to be in good shape by that time. But, you know, they're going to have to remain a little bit flexible. Yeah, I would say travel-related companies, certainly right now, they would be hurt. At the same time, this ends. This is going to end. Hopefully it'll be sooner rather than later. And I think the business that they lost will be picked up at a later date. But, you know, right now, I think they're not going to be, probably not going to be going to China. They're not going to be going to certain countries where the problem is far greater than it is in the United States. What it's going to do is keep people home, and they're going to travel to places that we have. We have it's the greatest tourism country in the world. So instead of leaving our country, leaving our shores, they'll stay here. And again, when you have 15 people, and the 15 within a couple of days is going to be down to close to zero, that's a pretty good job we've done.
What is your response to Speaker Pelosi, who said earlier today that you don't know what you're talking about the coronavirus? I'm also wondering if you want to address critics who say you can't be trusted about what your administration is saying.
Sure. I think Speaker Pelosi's incompetent. She lost the Congress once. I think she's going to lose it again. She lifted my poll numbers up 10 points. I never thought that I would see that so quickly and so easily. I'm leading everybody. We're doing great. I don't want to do it that way. It's almost unfair if you think about it. But I think she's incompetent, and I think she's not thinking about the country. And instead of making a statement like that, where I've been beating her routinely at everything, instead of making a statement like that, she should be saying we have to work together because we have a big problem potentially, and maybe it's going to be a very little problem. I hope that it's going to be a very little problem, but we have to work together. Instead, she wants to do that. Same thing with crying Chuck Schumer. He goes out and he says, the president only asked for $2.5 billion. He should have $8.5 billion. This is the first time I've ever been told that we should take more. Usually it's we have to take less. And we should be working together. He shouldn't be making statements like that because it's so bad for the country. And Nancy Pelosi, I mean, she should go back to her district and clean it up because it's the #1. If you look at percentage down, that was one of the finest in the world, and now you look at what's happening. And I'm just saying, we should all be working together. She's trying to create a panic, and there's no reason to panic because we have done so good. These professionals behind me and over here and over there and back here and in some conference rooms. I just left a group of 45 people that are the most talented people in the world. Parts of the world are asking us in a very nice way, can they partake and help them? So Nancy Pelosi shouldn't, and she knows it's not true. She knows all they're trying to do is get a political advantage. This isn't about political advantage. We're all trying to do the right thing. They shouldn't be saying, this is terrible, President Trump isn't asking for enough money. How stupid a thing to say. If they want to give us more money, that's okay. We'll take more money. Some Republicans think we should have more money, too. That's okay. We'll take more money. But they shouldn't demean the people that are on the stage who are the finest in the world. They're not demeaning me. They're demeaning the greatest healthcare professionals in the world and people that do exactly what we're talking about.
Your campaign today sued the New York Times for an opinion piece.
Yeah.
Is it your opinion or is it your contention that if people have an opinion contrary to yours that they should be sued?
Well, when they get the opinion totally wrong, as the New York Times did, and frankly, they've got a lot wrong over the last number of years. So we'll see how let that work its way through the courts.
Right?
No, if you read it, you'll see it's beyond an opinion. That's not an opinion. That's something much more than an opinion. They did a bad thing, and there'll be more coming. There'll be more coming.
Tokyo will host the Summer Olympics this July. Do you expect Tokyo will be?
I hope so, because Shinzo Abe is a very good friend of mine. I love the people of Japan, and I hope it's going to be in good shape. As you know, you have a number of people in Japan who have been infected. I hear they're doing a very professional job, which doesn't surprise me at all. With Shinzo and with all of the people you have, I know Japan very well. I think they're going to handle it very well. It's a little tight. You know, it's a little tight. They spent billions of dollars building one of the most beautiful venues I've ever seen. And your Prime Minister is very proud of it. I hope it's going to be fine. We hope it will.
Thank you very much, Mr. President. The doctor at CDC just talked about dusting off preparedness plans.
Right.
But coming from you, it has more weight. Do you feel that U.S. schools should be preparing for a coronavirus spreading?
I would think so, yes. I mean, I haven't spoken specifically about that with the various doctors, but I would think so, yes. I think every aspect of our society should be prepared. I don't think it's going to come to that, especially with the fact that we're going down, not up. We're going very substantially down, not up. But yeah, I think schools should be preparing and, you know, get ready just in case. The words are just in case. We don't think we're going to be there. We don't think we're going to be anywhere close. And again, if you look at some countries, they are coming down. It's starting to go in the other direction. This will end. This will end. You look at flu season, I said 26,000 people. I never heard of a number like that. 26,000 people going up to 69,000 people, doctor, you told me before. 69,000 people die every year from 26 to 69, every year from the flu. Now think of that. It's incredible. So far, the results of all of this that everybody's reading about, and part of the thing is you want to keep it the way it is. You don't want to see panic because there's no reason to be panicked about. But when I mentioned the flu, I said, actually, I asked the various doctors, I said, is this just like flu? Because people die from the flu, and this is very unusual. And it is a little bit different, but in some ways it's easier, and in some ways it's a little bit tougher. But we have it so well under control. I mean, we really have done a very good job. Go ahead.
Do you believe the number of fatalities? You mentioned the stock market earlier. To go back to that, to be clear, the Dow Jones dropped more than 2,000 points this week. Are you suggesting that that was overblown? Are financial markets overreacting here?
I think the financial markets are very upset when they look at the Democrat candidate standing on that stage making fools out of themselves. And they say, if we ever have a president like this, and there's always a possibility, it's an election, you know, who knows what happens, right? I think we're going to win. I think we're going to win by a lot. But when they look at the statements made by the people standing behind those podiums, I think that has a huge effect, yeah.
Had to do with the coronavirus?
No, I think it did. I think it did. But I think you can add quite a bit of sell-off to what they're seeing, because they're seeing the potential. You know, again, I think we're going to win. I feel very confident of it. We've done everything and much more than I said we were going to do. You look at what we've done. What we've done is incredible with the tax cuts and regulation cuts and rebuilding our military, taking care of our vets and getting them choice and accountability. All of the things we've done, protecting our Second Amendment. I mean, they view that, the Second Amendment, they're going to destroy the Second Amendment. When people look at that, they say, this is not good. So you add that in. I really believe that's a factor. But no, this is what we're talking about is the virus. That's what we're talking about. But I do believe in terms of CNBC and in terms of Fox Business, I do believe that that's a factor, yeah. And I think after I win the election, I think the stock market's going to boom like it's never boomed before. Just like it did, by the way, after I won the last election. The stock market the day after went up like a rocket ship.
At what point would you be considering loosening the travel restrictions regarding China?
When we're at a point where we don't have a problem. You know, we're not going to loosen the travel restrictions. That's what saved us. Had I not made, Mike alluded to it, had I not made a decision very early on not to take people from a certain area, we wouldn't be talking this way. We'd be talking about many more people would have been infected. I took a lot of heat. I mean, some people call me racist because I made a decision so early. And we had never done that as a country before, let alone early. So it was a, you know, bold decision. It turned out to be a good decision. But I was criticized by the Democrats. They called me a racist because I made that decision, if you can believe that one. We have to all work together. We can't say bad things, and especially when we have the best team anywhere in the world. And we really gave it an early start. We gave it a very early start.
Have consistently called for enormous cuts to the CDC, the NIH, and the WHO. You've talked a lot today about how these professionals are excellent, how they're critical and necessary. Does this experience at all give you pause about those?
No, because we can get money and we can increase staff. We know all the people. We know all the good people. It was a question I asked the doctors before. Some of the people we cut, they haven't been used for many, many years. And if we ever need them, we can get them very quickly. And rather than spending the money, and I'm a business person, I don't like having thousands of people around when you don't need them. When we need them, we can get them back very quickly. For instance, we're bringing some people in tomorrow that are already in this, you know, great government that we have, and very specifically for this. We can build up very, very quickly, and we've already done that. I mean, we really have built up. We have a great staff, and using Mike, I'm doing that because he's in the administration, and he's very good at doing what he does and doing as it relates to this. Yeah, go ahead. Go ahead, please.
Mr. President.
Yeah, go ahead.
So far your administration...
I picked him, but you're fine.
So far your administration is only testing less than 500 people, and health officials are questioning whether that's enough, comparing to other countries who have tested more than tens of thousands of people. Are you planning to test more people?
Well, we're testing everybody that we need to test, and we're finding very little problem, very little problem. Now, you treat this like a flu. We were, in fact, I might ask one of the doctors to come up and explain it. You want to wash your hands a lot. You want to stay, if you're not feeling well, if you feel you have a flu, stay inside, sort of quarantine yourself, don't go outside. But there are certain steps that you can take that we won't even be necessary. You know, in many cases, when you catch this, it's very light. You don't even know there's a problem. Sometimes they just get the sniffles. Sometimes they just get something where they're not feeling quite right. And sometimes they feel really bad. But that's a little bit like the flu. It's a little like the regular flu that we have flu shots for. and we'll essentially have a flu shot for this in a fairly quick manner. Yeah, go ahead.
2 weeks ago, Mr. President, your acting OMB director was in this room and was talking about what he expects to be GDP growth for this coming year. He said it was 3%, and we've talked about the effects of the coronavirus on the supply chain, the declines in the financial markets. Are you still confident that you'll see that kind of economic growth this year?
No, we're going to have tremendously low unemployment. We're setting records in that way. In fact, the administration is, as you know, the lowest average unemployment of any administration in history, and our numbers are very low, very good, 3.5, 3.6. But you can't really see what this does in terms of GDP. It could affect it, but that's irrelevant compared to what we're talking about. We want to make sure it's safe. Safety, number one. But this would have, an impact on GDP. But we're still we're doing great. But this will have, just like, I'll tell you what has a big impact. Boeing has a big impact. How did that happen? A year ago, all of a sudden, that happened. I think that took away a half a point to a point even. It's a massive company. I think Boeing, we had the General Motors strike. That was a big impact on GDP. And of course, we're paying interest rates. I disagree with the head of the Fed. I'm not happy with what that is, because he's kept interest rates. President Obama didn't have near the numbers, and yet, if you look at what happened, he was paying zero. We're paying interest. Now, it's more conservative, and frankly, people that put their money away are now getting a return on their money as opposed to not getting anything. But I think, we're the greatest of them all. We should be paying the lowest interest rates. And when Germany and other countries are paying negative rates, meaning they're literally getting paid when they put out money. I mean, they borrow money and they get paid when it gets paid back. Who ever heard of this before? It's a first. But we don't do that. So I totally disagree with our Fed. I think our Fed has made a terrible mistake, and it would have made a big difference. As good as we've done, even without the 2,000 points, and we started off at 16,000, and we'll be at 28,000. Without, we were going to crack 30,000. We have had increases like nobody's seen before, but we're doing well. But we have to watch. We're doing well anyway. In other words, even despite the 2,000 points, it sounds like a lot, and it's a lot, but it's not. It's very little compared to what we've gone up. But we'll be watching it very closely. But we have been hurt by General Motors. We've been hurt by Boeing, and we've been hurt, in my opinion, very badly by our own Federal Reserve, who has also created a very strong dollar. That's something nice about a strong dollar, but it makes it much harder to do business outside of this country.
Thank you, sir. A number of your supporters online have embraced these theories or forwarded these theories that the CDC may be exaggerating the threat of coronavirus to hurt you politically. Rush Limbaugh the other day said this has been advanced to weaponize the virus against you.
You don't mean my supporters, you mean my people that are not supporters.
Right, your opponents.
I agree with it. I think they are. I think, and I'd like it to stop. I think people know that when Chuck Schumer gets upset, I mean, he did the same thing with a couple of trade deals that are phenomenal deals now. Everybody's acknowledged they're phenomenal deals. Before he ever saw the deal, he didn't even know we were going to make a deal. They said, what do you think of the deal with China? I don't like it. I don't like it. He talked about tariffs. I left the tariffs on, 25% on $250 billion. He said he took the tariffs off. He didn't even know the deal. And he was out there knocking it, because that's a natural thing to say. But when you're talking about especially something like this, we have to be on the same team. This is too important. We have to be on the same team.
Have you seen evidence that the CDC is trying to hurt you? That
no, I don't think the CDC is at all. No, they've been working really well together. Yeah. No, they really are. They're professional. I think they're beyond that. They want this to go away. They want to do it with as little disruption, and they don't want to lose life. I see the way they're working. These people behind me, and others that are in the other room. They're incredible people. No, I don't see that at all.
Thank you, Mr. President.
Thank you very much.
I
don't know who said that, but
Thank you, Mr. President. Tonight, you're minimizing the risk, the danger of the virus. Are you telling the Americans, except for the ones who are sick, not to change any of their behaviors?
No, I think you have to always, I do it a lot anyway, as you probably heard. Wash your hands, stay clean. You don't have to necessarily grab every handrail unless you have to. You do certain things that you do when you have the flu. I mean, view this the same as the flu. When somebody sneezes, I mean, I try and bail out as much as possible with the sneezing. I had a man come up to me a week ago. I hadn't seen him in a long time, and I said, how you doing? He said, fine, fine. He hugs me, kisses. I said, are you well? He says, no. He said, I have the worst fever and the worst flu. And he's hugging and kissing me. So I said, excuse me. I went there, I started washing my hands. So you have to do that. You know, this is, I really think, Doctor, you want to treat this like you treat the flu, right? And, you know, it's going to be. I want to have you, it was so nice of you to say thank you very much. Go ahead, give me a nice question then. Don't ruin it. Don't ruin it with a bad question. Go ahead.
It's really nice to talk to you without the helicopter. I got to say that. But also, I want to talk to you about 2014. During the Ebola crisis, you said you wanted a quote-unquote full travel ban. You said Obama was a quote-unquote stubborn dope not for doing it. You said, just stop the flights, dummies. You also said it was a quote-unquote total joke to appoint someone to lead the Ebola response with, quote, zero experience in the medical field. Now you've appointed
They listened to a lot of what I had to say.
I did. So how does that square with what you're doing now?
They listened to a lot, well, because this is a much different problem than Ebola. Ebola, you disintegrated, especially at the beginning. They've made a lot of progress now in Ebola. But with Ebola, we were talking about it before, you disintegrated. You got Ebola, that was it. This one is different, much different. This is a flu. This is like a flu. And this is a much different situation than Ebola. But, and we're working on Ebola right now, by the way. We're working on certain areas of the Congo. The Congo has Ebola, and caused largely by the fact that they have war and people can't get there. We can now treat Ebola. At that time, it was infectious, and you couldn't treat it. Nobody knew anything about it. Nobody had ever heard of anything like this. So it's a much different situation.
The rate of mortality.
I think it was to me. Thank you. So, let me ask you this.
Yeah, go ahead.
In just the course of the last couple of minutes, you have disputed some of what the officials behind you have said about the risk of coronavirus and its spread. Do you trust your health officials to give you good information, or do you trust your own instincts more?
I don't think I have. They've said it could be worse, and I've said it could be worse too. I also think, no, I don't think it's inevitable. I don't think it's inevitable. I think that we're doing a really good job in terms of maintaining borders, in terms of letting people in terms of checking people. And also, that's one of the reasons I'm here today, getting the word out so people can, they'll know, they're going to know. No, I don't think it's inevitable. I think that there's a chance that it could get worse. There's a chance it could get fairly substantially worse, but nothing's inevitable.
Mr. President, Brazil has its first case.
That's right, Brazil.
Right, Brazil.
Yeah.
And you have many Americans now in Brazil for Carnival. What are your concerns, and what are the procedures and practices that you plan to implement as those Americans are trying to come back home?
Yes, we've gotten very strong on people coming in from Brazil. Now, it only has one case. It's a big country, but it only has one case. But still, it's a case. We deal with Brazil very well. The president's a very good friend of mine. In fact, he ran on exactly, it's called Make Brazil Great Again. That's what he ran on. We get along very well. I know you're so thrilled to hear that. We get along very, very well. And we're working with Brazil. But we have much worse instances than Brazil. You know, you have Italy and you have other countries where they have much more than one person. They have one person right now, as of just a little while ago, one person in Brazil. But Italy is, you know, a deeper problem. And we're checking people coming in very, very strongly from those. And at some point, we may cut that off. You know, at some point, depending on what happens, we may cut certain additional countries off, like we've had to do with China. And we hope we can open it up to China as soon as possible. And we hope the numbers we've been getting, are true on China, where it really has leveled off and started to go down. Because eventually, sometime, that's going to happen. Go ahead.
Thank you very much. You've said repeatedly that you think the federal government is very prepared, that you're ready for this.
Yep.
But if you think that Secretary Azar is doing such a great job, why did you feel the need to make a change and put Vice President Mike Pence in charge of the federal response to this virus?
And I think Secretary Azar is doing a fantastic job. But he also has many other things. I mean, we're working on many, many things together. If you look at his schedule of what he's doing, including drug prices, and I think it's perhaps the most complicated job that we have in government. And I want him to be able to focus on that. And Mike is really good at it. They're going to work together. They're going to work very closely together. And they're both in the administration. I see them all the time, so it really works. This isn't a czar. This isn't going out and getting somebody that's never been in the administration. I have two people that are very talented, and it's something I feel good about. I don't want to spare the horses. I have very talented people. I want to use them on this because I want it to stay low or as low as possible.
Thank you, Mr. President. I want to get to China. At the beginning of this outbreak, the Chinese Communist Party covered it up. That has been the general consensus of everyone. How can you now legitimately trust President Xi and the Chinese Communist regime, President Xi, and the Chinese Communist regime to be forthcoming and forthright with this pandemic?
Well, I can tell you this. I speak to him. I had a talk with him very recently, and he is working so hard on this problem. He is working so hard, and they're very tough and very smart, it's a significant group of very talented people that are working. And they're calling up Dr. Fauci, they're calling up our people, we're dealing with them, we're giving them certain advice. We actually have, through World Health, we have them over there also, and we have a lot of our people making up that group that went over there. No, he's working very hard. It'd be very easy for me to say, doesn't matter what I say, really. I can tell you, he is working. I had a long talk with him the other night. He is working really, really hard. He wants it to go away from China and go away fast, and he wants to get back to business as usual.
Because about the flu and in comparison to the coronavirus, flu has a fatality ratio of about 0.1%.
Correct.
This has a fatality ratio somewhere between 2 and 3%.
Well, we don't know exactly what it is. And the flu is higher than that. The flu is much higher than that.
There's more people who get the flu, but this is spreading, or it's going to spread maybe within communities. That's the expectation. Does that worry you? Because that seems to be what worries the American
No, because we're ready for it. It is what it is. We're ready for it. We're really prepared. We have, as I said, we have the greatest people in the world. We're very ready for it. We hope it doesn't spread. There's a chance that it won't spread, too. And there's a chance that it will. Then it's a question of at what level. So far, we've done a great job. When you have 15 people with this whole world coming into the United States, and the 15 people are either better or close to being better, that's pretty good. All right, we'll do one more. Go ahead.
Mr. President, thank you. There have been many cases of price gouging on the sales of medical equipment, masks, and so on. Should the government be investigating that, looking into it, and do you have a message on that?
If you tell me that's happening, we would definitely investigate. We don't want that. All right, one more. Go ahead. Go ahead.
Mr. President, thank you.
Go ahead. No. Yes? Go ahead.
Are you working with China right now, specifically in what areas? Also,
we're working with China. We just did the biggest trade deal in history. We did 2 of them between USMCA and the China deal. It's the biggest in history. The relationship with China is a very good one. And I can tell you that, again, President Xi is working really hard. He wants this problem solved as hard as you can work. Thank you all. Thank you all. I may leave you behind and you can answer a few more questions. So you can ask them of you.
That's United States President Donald Trump addressing reporters, the country, and the world on the coronavirus outbreak. He told us there that the risk in the United States is very low. People are getting better. He pointed out that in this country there were 15 original cases. There are many more cases, but these are from people who were on cruise liners around the world and people who have flown into the United States. But of those 15 people, 8 people have already been sent home. As far as money is concerned to tackle this viral outbreak, he pointed out that Congress has approved $2.5 billion. That amount could increase to up to $8 billion. Insofar as liaising with the rest of the world and what the United States is doing, a specialist has been appointed at the State Department. He also pointed out that Vice President Mike Pence will be heading a coronavirus task force, which will bring together health professionals, government professionals, people in the administration on how they tackle this. And we heard from health professionals in the United States telling us that the United States is adopting a very aggressive containment strategy here. And as far as vaccines are concerned, there's also trials taking place that's also very aggressive. Well, I have still with me Catherine Jacobson, Professor of Epidemiology and Global Health at George Mason University. Very positive spin from the president there on what's going on. Does it assure the country that everything's under control?
At the big picture level, it was very reassuring in terms of letting people know that the federal government is working closely with states and that they have plans in place for handling the big picture stuff. At the closer to the ground level, I think a lot of people who are watching this evening were wanting to know, what should I be doing? That question wasn't really answered. I think what we're going to be seeing a lot of is mention of social distancing, which means that if we start seeing cases in the U.S., people will be asked to keep their social distance. That might mean closing schools, not so much because we're worried about kids getting infected and getting really sick, but because we don't want people mixing and then those kids taking that home and infecting other people. So those sorts of individual level instructions about what to do were not very clear. And the president, I'm sure, would say, we don't have that local transmission yet, so let's not worry. But for people who want to prepare, being prepared to do that social distancing, so working from home, potentially schools closing, that sort of thing, if this starts to have local transmission, as we expect is likely in the coming weeks.
Of course, he referred people to websites and things like that to get more information on what they can do.
And cdc.gov does have a very good website with all of the current information. That's a great place to check.
Catherine, thanks so much for being with us. Thanks for your patience, staying with us. It's been great having you. And that's it for this special edition of The Heat. I'm Anand Naidu in Washington, D.C. Thanks for being with us. Hello everybody, I'm Anand Naidu. If you enjoy the thoughtful, engaged discussions you see on The Heat, you may also want to subscribe to our podcast. It's appropriately titled The Heat. Twice a week we take a deep dive on world headlines, talking to experts, journalists and others. It's a fresh, focused and intimate look at the issues that matter most. Whether it's the Hong Kong riots, the latest Middle East conflict or US politics, The Heat podcast gives the clear context needed to understand both what's going on and why. And what's best, we come to you. Whether you're at home or on the go, you can find the Heat podcast just about anywhere podcasts are found. Just search The Heat CGTN. Have a listen today and subscribe. Thanks.